Okay. Hey everyone, Dr. Madeline here from Forward Spine Center, and today I'm excited to be sitting down with Dr. Alexandra Quinn, founder of Quinn Essential Naturopathic Medicine here in Excelsior. So thanks for having me. Dr. Quinn is passionate about helping patients get to the root cause of their health concerns, particular in areas like women's health, digestive health, and complex chronic conditions. Her thoughtful, whole person approach combines evidence-based medicine with a deep understanding of how our body's systems work together. Thanks for having me.
Thanks for having me.
Yeah. So let's start out with can you just explain exactly what is a naturopathic doctor and how does your approach differ from a patient who might experience in a traditional medical environment?
Yeah, that's a great question because naturopathic doctors, so it's a 4-year medical degree. So it's very different than, say, like a naturopath. So essentially, there's about 5 accredited ND schools in the country. Most of them are on either the East or West Coast. So that's one reason that NDs we're not as familiar with naturopathic medicine here, is just the lack of schools. But basically, the first 2 years are exactly the same as a traditional allopathic program, MD-DO. So lots and lots of anatomy and physiology, pathophysiology, cadaver labs, you name it. And then I would say those last 2 years are a little bit different in that we're integrating botanical medicine training, homeopathy, lifestyle training, nutrition. We do still get the training in pharmaceuticals, and I do have a board certification in pharmacology. However, in the state of Minnesota, I can't prescribe. But the approach, I would say, is also a little bit different in that, from day one, we're really looking at the body as a whole, as the person as a whole, and not kind of a series of separate organ systems. So, if someone's having, hormonal concerns, I want to know what's going on with their nervous system, with their digestion, with their environment around them, because, our systems don't operate in little silos. Everything is kind of interconnected. And I think, so we definitely utilize, kind of a whole array of things in our toolkit, whether it be evidence-based natural therapies, sometimes pharmaceuticals when they're warranted, to really, dive into and address some of those root causes of someone's kind of current presentation.
Yeah, which kind of brings us, you talk a lot about the root cause medicine. So what does that actually look like when a patient walks through the door?
Yeah. So, I would say, identifying root cause medicine is essentially identifying and addressing obstacles to health. So I practice from a very vitalistic perspective of medicine, where I truly believe the body has just been designed to have this amazing innate capacity to heal. Sometimes we need a little extra help in identifying some of those barriers to healing. So I would say, part of doing that as far as root cause is looking at some of the underlying, it could be infections, it could be nutrient deficiencies, it could be environmental exposures, nervous system dysregulation, it could be big T, little t traumas, things like that, which can really kind of, I would say, inhibit optimal functioning of the body. So it's never all about, endless protocols and whatnot, but it is being really pertinent with which of these things could be really affecting the person that I'm, who's sitting in front of me.
And how everything kind of works together. Yeah. Because one thing that really stood out with your website is how you emphasize, you place a lot of interconnectedness on the body system. So what is important to look beyond? Why is it important to look beyond just a single symptom or diagnosis and look at the whole?
Yeah. I mean, we like to think of the body operating in these algorithmic kind of symptom pictures and checking all the boxes of this one thing. And then we can kind of allocate, say it's a digestive condition or inflammatory bowel disease. You have your gastroenterologist, that's your thing. But we're really not looking beyond that, and how having an inflamed colon could be affecting the rest of the body, or what might be contributing in the first place to that inflamed colon. So, that's where I think it's important to take a step back. And this is where I love seeing this in the world of functional integrative medicine. I would call naturopathic doctors the original functional medicine practitioners, but it's best, it's something that's gaining a lot of traction in the medical world because, people want to be, people are recognizing this about themselves, that they're not just, checking off certain symptoms, and they don't want just symptoms managed. They want to restore, optimal health. And that requires looking at everything.
Yeah, exactly. Like in just thriving versus, and a lot of times like the GI, it leads to other things down the road. Like you might all of a sudden have brain fogginess. So then you're treating this condition with a different practitioner and you're kind of addressing it all in one sitting, right?
Yeah.
Awesome. So you work with a lot of different patients dealing with also complex chronic conditions. So what are some common themes you see among patients who are searching for answers, like for the years?
Yeah, I would say a lot of dismissal, a lot of feeling like they haven't gotten the answers they're looking for, a lot of feeling unheard. Gaslighting is not an uncommon thing to hear, unfortunately. Or, it's just people who have been told that everything looks normal and, they're kind of left scratching their heads. Well, I still don't feel normal. I would say that's definitely a really common theme is, and, as far as blood work goes, there's a difference between a normal conventional reference range and more like optimal function. So, even if someone has had, this whole panel of labs done and they fall within those conventional ranges, we might still see discrepancies there that may not necessarily reflect, again, optimal function. But so it's kind of helping to, I also like to just be the partner and the ally and that voice for patients who feel like they haven't been heard, who know something's wrong, who have basically become their own doctors and are, a wealth of knowledge because of it. They've kind of been forced into that. Just knowing that they have an ally, someone who will hear them and kind of advocate for them in the medical world and beyond. Yeah.
And you just bring so much knowledge, like just a natural route of knowledge. I like how you even like brought in like herbals and just different things that, it's like a different language. So you're full of just different. And so as a chiropractor, I talk a lot about how stress and the nervous system function affects overall health. How do you see the nervous system dysregulation impacting patients?
In so many ways, I would say, especially in some of those like really complex patients, if we're not addressing the nervous system, we're not going to get the results that we're looking for. Just because, it could be things that the body's holding on to from years and years ago that we haven't quite moved through. It could be maladaptive coping mechanisms, that we've also, curated from a young age that are no longer serving us. But that, having that dysregulated nervous system response can affect immune function, digestion, hormonal balance, energy, cognition. So it's really important.
It's a part of the piece.
It's a huge piece. Yes. Yeah.
So if you would leave anyone who's watching this with one piece of advice, what would that be?
I would say the advice would be to know that your body is capable of, I would say, of healing at any level, and that you don't have to be, reliant long-term on anyone else. And the message I want to send is one of empowerment. And, because even when I think of my role, I don't really consider myself a healer. I consider myself a facilitator, and that your body is doing what it's doing, and that, you're setting the stage, you're the one implementing, hopefully, my recommendations. So I want patients to feel empowered, and and it gives hope, it gives optimism and autonomy. Yeah.
Awesome. Well, thanks for letting me be here. You're such a light.
Thank you so much. I appreciate it.
Dr. Madeline, thanks for allowing me to be part of your health journey.